Hi, I'm Ryan Nutter, CEO and Principal of Cornerstone Senior Advisors, and in this video we're going to talk about Medicare's annual election period. What do you need to know and why is it so important to you? You may be someone who's very satisfied with your health insurance on Medicare, and that's great. But I'm going to show you and explain to you why you need to review your plans each year and pay attention to the Medicare annual election period, whether you're satisfied with your plans or not. Because if you want to make sure that you're happy with your coverage year after year after year, there's just some things you need to look at and some things you need to know. Now, before we get into the annual election period, let's back up and just look at the two different options, the two different routes with Medicare that you can take. First option, you can go with original Medicare and a supplement with a standalone drug plan. So when I talk about Medicare supplement plans, we're talking Plan F, Plan G, Plan N, things like that. You combine those with original Medicare to fill the gaps of Medicare. I've done videos on all of those plans. If you want to check out those videos, feel free. When you go with original Medicare and a supplement like that, you're going to then get a standalone drug plan. This is your PDP, or standalone prescription drug coverage. That's your first option with Medicare. Your next option is Medicare Advantage. It's also called Part C. Now, these Medicare Advantage plans are different ways to receive your health insurance with Medicare. Medicare's handing responsibility for your health care off to the private insurance company, and there's things we really need to look at in how Medicare, the annual election period, benefits you in being able to review these plans year after year. So we're going to break down how the election period, Medicare's annual election period, affects both of these options. First off, before we get to that, I do want to say that the annual election period runs October 15th through December 7th. You've got to review your plans within this time frame. That's your window. You get to December 8th and on, we're done, and there's no more options for reviewing these plans. You can make your moves within this window of October 15th through December 7th. Now, come October 1st, we are able to talk with you about the coming year's plans. Come October 1st, we can begin to dialogue about what coverage you have, how it's changing going into next year, and if you have other options that may be better for you for the next year. But we cannot take enrollments until the 15th, and we can continue to take enrollments until December 7th. So let's start out talking about Medicare Advantage plans. Like I just said a moment ago, Medicare Advantage plans, they call them a different way to receive your Medicare benefits. These Advantage plans have become more and more popular over the years, and there's some advantages to those plans. I do want to mention I have several videos on Medicare Advantage plans, the advantages and disadvantages, which you can watch if you would like. But for now, I'm just going to talk about, well, how does the annual election period affect Medicare Advantage plans? I tell my clients these Medicare Advantage plans are moving targets. And what I mean by that is they change a little bit year by year. So your plans can change what your copays look like when you go to a healthcare professional. They can change, do they cover dental? If they cover dental, what's the dental coverage look like? Can you go out of network? Do you have to stay in network? Is the coverage different if you go out or in of network? All of those things can change. How well do they cover your medications? That's a big one with these Medicare Advantage plans. All of these Advantage plans, if you have an Advantage plan that comes with prescription drug coverage, well, they can change those drug plans year after year. And so you need to review to see if your Advantage plan that you currently have is going to cover your medications well next year like it did this year. That's very important to make sure that you're reviewing and keeping up on these things. Now, anytime I'm working with someone that's looking at a Medicare Advantage plan, there's three things I always tell them we need to look at. We must look at these three things before you ever pull the trigger on a Medicare Advantage plan. And these are three things that you need to look at each year in the annual election period. Number one is network. These are network plans. You want to make sure your healthcare provider is in network each year. Networks can change. They can also be moving targets. They can grow and they can shrink. So you want to make sure, okay, is the plan I'm on right now, is my healthcare provider going to be in network next year, or do I need to move to a different plan because things have changed? So one is network. Check network every time. Number two, how well do they cover your medications? This is what we just talked about. When you go with a Medicare Advantage plan, you can't go get a standalone drug plan to help with medications. Whatever drug coverage they offer is what you get. So before you pull the trigger on an Advantage plan, you want to make sure they cover your medications well. And each year, how well they cover medications changes. So just make sure that you're reviewing those things before you decide to keep the plan you have. And if you're looking at a different plan, make sure you review those things. The third thing is reputation. Now, this is where working with someone like myself comes into play, because we work with all these companies every year. Some companies are a little bit easier to work with than others. The last thing you want to have happen is end up with some health issue, you end up hospitalized, and you're having to fight this insurance company to make sure your claims are paid. When you're in a hospital, you just want to focus on getting better. Well, some companies have been easier to work with, so let's talk about that. Who's performed well? Who's a company I'd never sign my mom up with? That's a phrase I always use. So those are three things that we always talk about with Medicare Advantage plans: is network, how well they cover your medications, and what's their reputation. How have they performed in the past? So let's shift gears and talk about Medicare Supplement with a prescription drug plan. First off, with your Medicare Supplement plans, those are guaranteed renewable and those are steady. So when we talk about the Medicare annual election period, actually they don't affect the Medicare Supplement plans. Those are going to renew, they're going to carry on to next year, and to this point, they've never changed coverages with those supplemental plans. There have been plans that have been discontinued, which means those plans are no longer eligible for new Medicare beneficiaries, like the Plan F, but if you already have a Plan F, you're grandfathered in and your coverage is the same. So if you have a Plan G, if you have a Plan N, whatever supplemental plan you have, it is going to be the same going into next year. Now, it is a good time for you to review how much are you paying for that Medicare Supplement plan and what other companies offer that Medicare Supplement plan, because you may be able to get that Plan F or that Plan G and cut your annual cost down by $500 or more. That's something that we can review because all of these plans are standardized. We've got videos again on these supplemental plans. You can watch those and explain the standardization of these supplemental plans. A Plan G is a Plan G is a Plan G. Whether you get it from company A, B, C, or D, it's a Plan G. Are you paying more than you need to pay for that plan? Why trade quarters for dimes type mentality? So it is a good time to review and just see, okay, can I cut some costs? Can I keep the same plan but get it at a lower rate? Now the drug coverage. When you go this route, when you get a Medicare Supplement plan to fill the gaps of Medicare, you're going to have a standalone drug plan. What's very important for you to look into and to look at is this drug plan I'm on currently still going to cover my medications well next year? Again, just like the Medicare Advantage plans, these drug plans are moving targets. They can and do change year after year after year. So they can change their premium, they can change what medications they cover, they can change how well they cover medications, and they can change what pharmacies they work with. Typically, there's over 20 different drug plans available in each area of the U.S. You want to make sure whatever plan you're on is covering your medications well. I've seen drug plans go from $20-some a month in premium to close to $70 a month in premium in 1 year. And people that did not review their plans get stuck with this drug plan paying close to $70 a month when they have no business paying that type of premium for a drug plan. So it's really important to review your drug plans. Now, what we do in our office is we're going to talk with you and we're going to plug in each of your medications. We're going to run those medications through every available plan. So we're going to plug in what medication you're on, how many milligrams do you take a day, what pharmacy do you use. We're going to run that information through every available plan and let our computer tell us, taking into account all of your out-of-pocket costs, premium, deductible, copays, so on and so forth. We're going to let our computer tell us which plan is going to be the lowest out-of-pocket expense for you each given year. And we're going to review that each year to make sure you're in the best plan that fits your needs each given year. So these are some really important things to pay attention to and look at year after year. Just have a phone call and maybe we're going to tell you, hey, stay right where you're at. You're in the best option for you, but at least you have that peace of mind knowing the plan you have now is still the best option for you for next year. So we need to at least have a phone conversation just to see if you should stay where you're at or move somewhere else. So I hope you found all of this information helpful. I hope you found this video helpful. We want to be a blessing and a benefit to you. I do want to mention that I have this book that I wrote called Medicare Made Simple, where we break down Medicare, the ins and outs of Medicare. What is original Medicare? What gaps do you have with original Medicare? What are supplemental plans, advantage plans, drug plans? You can cipher through this book, and we really try to break Medicare down so it's really understandable and easy to make decisions, because health insurance is a big deal. If you want a free copy of this book, just give us a call, 316-260-3331. We'll ship a copy out to you free of charge, no questions asked. We want to be a blessing to you. If you have questions on anything that I've just covered, anything I've said, please call us. We'd be more than happy to walk you through all of your options. Annual election period's coming up. It's just around the corner. Call us, 316-260-3331. Thanks for watching.